There's been a lot of reporting in the last 24 hours about a Parkinson's expert who's come to visit the White House almost a dozen times over the last year or so, including at least one meeting with the president's physician. Could you state, very clearly, yes or no, was that expert here to participate in anything surrounding the care of the President of the United States?
So let me just say a couple of things. We have had a comprehensive, and I just want to take another step back, comprehensive physical examination. The president has had that. We've given a comprehensive report. We've shared that the past 3 years. Every year that he has had this exam, he sees a neurologist. And just to give you a quote from that, from the report most recently in February, an extremely detailed neurological exam was again reassuring in that there were no findings which would be consistent with any cerebellar or other central neurological disorder such as a stroke, multiple sclerosis, Parkinson's, or ascending lateral sclerosis, end quote. So that came directly from in February in that comprehensive report that was provided by the president's doctor to me, that I share with all of you. So anyone who is watching can certainly go to our website.
The White House released a letter from President Biden's physician on Monday night after Press Secretary Karine Jean-Pierre faced repeated questions during a briefing earlier in the day regarding the president's health and whether visits to the White House by a Parkinson's disease specialist involved the president. According to White House visitor logs, first reported by the New York Post and the New York Times, Dr. Kevin Kennard, an expert on Parkinson's disease, visited the White House 8 times from last summer to this spring. The logs indicate that Dr. Kennard met at least once with President Biden's personal physician. Jean-Pierre addressed reporters on Monday afternoon, stating that the president is not being treated for Parkinson's disease. Has the president been treated for Parkinson's? No. Is he being treated for Parkinson's? No, he's not. Is he taking medication for Parkinson's? No, she asserted. However, Jean-Pierre declined to confirm the doctor's visits, citing security reasons, which led to a tense exchange with reporters. This scrutiny comes as the president faces criticism, urging him to end his re-election campaign following a contentious debate performance against former President Donald Trump on June 27th. You're not answering a very basic, direct question about the doctor's visits, CBS News' Ed O'Keefe pressed Jean-Pierre. Every year, around the president's physical examination, he sees a neurologist, Jean-Pierre explained. That's 3 times. At the White House or Walter Reed? O'Keefe inquired, referencing Walter Reed National Military Medical Center, where presidents typically undergo their annual physical exams. President Biden had a checkup there in February. That is what I'm sharing with you. So every time he has a physical, he has had to see a neurologist. So that is answering that question. Jean-Pierre responded, Did Dr. Kevin Kennard come to the White House specifically because of the president's condition? O'Keefe asked again. For security reasons, we cannot share names, the press secretary reiterated. We cannot share names of specialists broadly, from a dermatologist to a neurologist. CBS News pointed out that the visits were public information, but Jean-Pierre maintained that she could not confirm the visits due to privacy concerns. It doesn't matter how hard you push me. It doesn't matter how angry you get with me. I'm not going to confirm a name. It doesn't matter if it's even in the log, she said. It is inappropriate. It is not acceptable. So I'm not going to do it. Monday night, the White House released a memo from the president's physician, Dr. Kevin O'Connor, who indicated he had obtained permission from President Biden and Dr. Kennard to share more details. Dr. Kennard was the neurological specialist that examined President Biden for each of his annual physicals. His findings have been made public each time I have released the results of the president's annual physical. President Biden has not seen a neurologist outside of his annual physical, O'Connor wrote, noting that Dr. Kennard has been the neurology consultant to the White House Medical Unit since 2012. O'Connor also highlighted that Dr. Kennard's regular visits to the White House Medical Unit are in support of the thousands of active duty members assigned to White House operations. Many military personnel experience neurological issues related to their service, and Dr. Kennard regularly visits the WHMU as part of his general neurology practice. The president, steadfast in his decision to remain in the race, has taken an offensive stance in recent days. Since the debate, President Biden has been actively participating in interviews, campaign events, and outreach to prominent Democrats and donors to bolster support. "I am not going anywhere," President Biden stated in a phone interview with MSNBC's Morning Joe on Monday. "I wouldn't be running if I didn't absolutely believe that I am the best candidate to beat Donald Trump in 2024. We had a Democratic nominating process where the voters spoke clearly." In a letter to congressional Democrats on Monday, President Biden emphasized his firm commitment to continue his campaign and called for an end to discussions about his potential withdrawal. First Lady Jill Biden, considered influential in the president's decision-making, echoed his sentiments during a campaign stop in Wilmington, North Carolina. "Joe has made it clear that he is all in," she affirmed. "That's the decision that he's made. And just as he has always supported my career, I am all in too." While several House Democrats have called for President Biden to withdraw from the race, many have continued to support him. No Senate Democrats have publicly urged the president to step aside, though some have encouraged him to demonstrate his capability to fulfill the role. Among those advocating for President Biden's withdrawal is Washington Rep. Adam Smith, who told CBS News on Monday there would be a huge sigh of relief amongst just about every Democrat in the House if the president ended his campaign. "We would be better off with another nominee," Smith stated. "I believe that in my heart, my soul, my brain, I'm 100% convinced of that." A recent CBS News poll indicated that the race has shifted slightly in favor of former President Donald Trump following the June 27th debate. Trump now holds a 3-point lead over President Biden in battleground states and a 2-point advantage nationally.